Welcome to the first Pain Management Handbook audio recording from Pain Management. I'll be reading through the content of the handbook and drawing attention to places where you can pause and take part in an activity or if there's something for you to do. Introduction. This handbook is designed to help you understand and live with your chronic pain condition. It can be used either within a pain management program or in one-to-one sessions with a pain management solutions clinician. It contains most of the information that is usually discussed on a pain management program, as well as spaces to fill in extra information that may be helpful to you. The advice in this handbook can help you improve your quality of life and how you feel. It can also help you to do the things that you would like to do. The advice in the handbook can help you to live well with your pain. Sadly, it is not always possible to get rid of long-term pain. The handbook is divided into weekly sections that cover different approaches to managing pain. It is important that you have the chance to talk through the contents of this handbook with a clinician. The handbook is not intended to replace meeting with a clinician or coming to a program. If you are in doubt about anything in the handbook or have a flare in your symptoms from following advice given, please discuss this with a pain management solutions clinician. Each of the chapters start with an explanation of the background to the content of the chapter. The next section will give you some advice on how to use the information given. Any written explanation surrounded by a box is more complicated, and we'll draw attention to this in the recording. You do not need to know this, but you might find it interesting. Week 1. Week 1. Introduction to the program. Setting down the basics. What can the program do for you? Introducing pain and the biopsychosocial aspects of pain. Introducing pain biology and what you can do about it. The power of positive psychology. Introducing enjoyable movement and stretches and the benefits of exercise and activity. Introduction to relaxation and mindfulness with a 3-minute breathing space. So chronic pain. Put simply, chronic pain is pain that has lasted for a long time. Following an injury, the body usually repairs itself in a short period of time. Pain that lasts for a short time is called acute pain and is the pain you have when the body is repairing itself. Chronic pain is the pain that remains when the body has finished repairing itself as well as it can. Chronic pain can be due to an ongoing problem that causes pain. An example of this could be arthritis. Most of the ways that we treat pain are good at helping pain that does not last a long time. Sadly, the ways that we treat short-term pain can be unhelpful or even damaging to us if we use them for a long time. Acute versus chronic pain. Acute pain is useful as it protects us from hurting ourselves. It makes us stop using a part of our body so we have time to heal. The body normally repairs itself within 3 months. Pain that lasts for longer than 3 months is referred to as chronic pain. Chronic pain is no longer helpful and it does not protect us. Stopping activity or taking lots of medications will not help manage chronic pain. The two lists opposite show how acute pain and chronic pain are different. So acute pain is listed as lasting in the short term for less than 3 months, and that pain in this situation equals tissue damage. Point 3 says that acute pain is helpful or protective. Pain tells us what is happening and helps to protect the body and avoid harmful activity. Point 4 says that acute pain responds to medication and treatments done by someone else. Point 5 says that pain usually lessens over time. In the chronic pain list, point 1 is that chronic pain is long-term, it's more than 3 months. Pain is not caused by new tissue damage anymore. Point 3 says it's unhelpful, misleading signals that cause suffering and low mood. Chronic pain can make us stop activity, which is not good for our body or for our health. Point 4 says that pain does not usually respond well to medication or treatments that are done by someone else. Medication is often increased, but this doesn't change the pain much and has lots of side effects. Pain remains and is changeable. People have good and bad days. The development of chronic pain. Chronic pain is pain that is still there after your body has tried to repair itself. When you have chronic pain, the day-to-day pain does not mean that you have recently damaged your body. This section explains how your body starts to feel more pain than it needs to. The explanation is quite complicated. You do not need this to manage your pain. Chronic pain often starts after you have had very strong pain for a long time. This strong pain teaches your nerves in your brain and spine to be more sensitive. This is called central sensitization. The word central is referring to the central nervous system, which is the name given to your brain and spinal cord together. When someone has central sensitization, even normal touch and temperature changes can feel painful. Pacing and graded exercise may help change the amount of central sensitization that you have. We'll see that in later sections. Our nerves can learn. They do this by changing how sensitive they are. In the image in the handbook, this is demonstrated and will be described below. When a nerve is used a lot, it grows more gates. These are things on the ends of the nerve where information can pass. It is more likely to send a signal more quickly. All nerves can do this. Normally this is a good thing. It is how we remember things and how we get better at doing things. With chronic pain, it is not such a good thing, as it means that your pain nerves become more sensitive and send more signals. This process is called long-term potentiation. It is thought to be part of your normal memory system and is usually helpful. So in the image, there is two ends of nerve axons at a synapse. It demonstrates neurotransmitters or messengers passing from one nerve and entering the gate of another, and this generating a signal. With long-term potentiation, you might have more neurotransmitter being produced by the first nerve and more gates for those neurotransmitter chemicals to pass in, and you see a bigger signal. Pain and emotions. There is a strong link between pain and how you feel. Low mood, depression, stress, anxiety, and expecting something to hurt you can increase your pain. The longer people experience pain, the more of our pain and mood are linked together. Scientists looking at how the brain works have seen how the brain changes over time. With short-lasting pain, the parts of the brain that are used for pain are active. As the pain lasts longer, these parts of the brain become less active. The longer the pain lasts, the more the parts of the brain used for emotion become active. We don't know why this is, but it might be that the daily experience of pain and the memory of hurting us makes the emotional parts of our brain more active. This may increase suffering and reduce quality of life. Some people find medication helpful with low mood. However, we need many other ways to help manage our mood when we have chronic pain. This will stop us becoming stuck in low mood and suffering when we feel pain. This handbook will show you ways of working on your mood and thoughts. This will help improve your sense of well-being and improve your chances of enjoying life. These ways of working on mood can even work even though you are in pain. They may even mean that the pain has less effect on you. It's all in the head. When people find out that pain management looks at our emotions and thoughts, they often become afraid that this is because people think that pain is, in quotations, all in their heads. Even worse, some people may have even been told the pain is all in their head by a health professional. To be clear, pain that is made up by the brain is rare. Pain can be made to feel worse by moods and thoughts, but it's not usually made up by your mood and thoughts. If you think something will hurt, this may increase the amount of pain you feel when it happens. But this worry or anxiety does not create the pain. In this case, worried attention amplifies the pain. Working on your thoughts, your mood, and how much attention you give to pain can be helpful. By working on this, the pain can become less bothersome to you. This is one of the reasons why we look at psychology on a pain management program. So coming up next, there is an activity. The activity asks you to think of a time when you were enjoying yourself. Then think of a time that you were feeling upset. What happened to your pain at these times? It asks you to think of the physical, the thoughts and emotions that happened, and the relationships and activities and how they were affected. It breaks this down into the biopsychosocial. Chronic pain can turn people's lives upside down. If you list the ways that pain affects people, you will find that it causes different types of problems. It gives people physical problems, biological. It affects their thoughts and mood, psychological. And chronic pain can cause difficulties with relationships, work and other activity, social. To manage the chronic pain well, people need help with these three types of problems: biological, psychological and social. This is why pain management programs are called a biopsychosocial approach. They help people improve in these three ways. This handbook shows you how to use a number of the biopsychosocial approaches. It may not be possible to get rid of the pain, but people can often improve their quality of life and ability to do what they want to do by engaging in these approaches. How can we influence the pain process? Pain affects how we move and how we use our body and what we can do. Pain grabs our attention. When we focus or pay attention to unpleasant things, it can be difficult to feel or remember pleasant things. This can lead to an even lower mood and sometimes lead on to depression. When we can't do things and our mood is low, our relationships and work can suffer. People with chronic pain experience large amounts of stress. This is because the pain and what they are not able to do anymore. Stress and pain can often affect their sleep. All of these problems overload the nervous system. This in turn can increase the pain and suffering that people feel. This can become a vicious cycle. Luckily, we can influence this process and improve our well-being, quality of life and our ability to do things, which can make the pain less noticeable in our life. Though through using pain management approaches, we can become happier and even get to the point that the pain is no longer having much effect on us. People say that when they use the approach in this handbook, the pain bothers them less. To manage the pain, we learn to accept the pain condition for what it is. As you stop fighting your pain, you stop fighting yourself and your own experience. This helps reduce your stress and suffering. We learn to improve our body's movement in a way that we can easily manage and does not wind up our symptoms. We can learn to reduce our levels of stress and tension. We learn to find ways for difficult or unpleasant experiences to have less effect on us. We learn to do what we need to do and do what is important or meaningful to us. We learn to improve the way we think about pain. We learn to make the focus on the pain less in day-to-day life. We learn to improve our ability to relax and sleep, allowing ourselves to feel more refreshed. We learn to improve our mood so that we are more able to deal with the difficulties that life throws at us. This handbook, in conjunction with working with pain management solution staff and pain management programs, will help you to learn these things. Psychological and social approaches to pain. Pain can make us unhappy. It can make us feel low. It can stop us when we are trying to do things and make us nervous about trying almost any activity. As pain affects our life, we can feel less self-worth. We can also feel guilty. Over time, the pain condition starts to change our beliefs, changing what we think we can do and the way that we look at ourselves. The following parts of the handbook looks at thoughts and feelings. It will teach you some of the tools to help change your beliefs about pain. The tools will also allow you to have the confidence to start doing things that currently may make you nervous. The handbook covers 3 ways to help. Cognitive behavioural therapy approaches to pain management is number 1. Number 2 is positive psychology. And number 3 is mindfulness-based approaches to pain management. Cognitive behavioural therapy, CBT, approaches to pain management. Cognitive behavioural therapy is based on the idea that unhelpful thoughts and behaviours can make problems worse. By recognizing unhelpful thoughts and behaviors, a person can improve how they feel. They can also improve areas of their life that have become difficult. CBT does not spend time looking in the past. It looks at the here and now and focuses on solving a person's current problems. The sections in this handbook on helpful thinking, graded exercise, and communication are influenced by CBT, as cognitive behavioral therapy is also known. Positive psychology, happiness and well-being need to start now. Chronic pain can leave people with a feeling of sadness and suffering. This can be hard to overcome. These feelings cannot be changed by looking at the negative parts of life or listing the problem in life. Positive psychology helps people to enjoy their lives, increasing the things that make us happy and reduce the negative thoughts and feelings. It can help people have a more happy life. Often people feel their life stops as they wait for their pain to go. Positive psychology asks us to change our thoughts so that we can improve our lives, even with problems that we have right now. We'll also look at making movement and activity enjoyable to help people change from suffering to a feeling of happiness. Mindfulness-based approaches to pain management. The response to pain can sometimes be likened to a cat with tin cans tied to its tail. The faster the cat tries to get away from the noise, the more noise the cans make, making the cat run even faster. This unpleasant example describes how people can feel with chronic pain. As they constantly try to get away from the pain, they spend more of their time focusing on it. This makes it a bigger problem and increases their distress and suffering. The primary goal of mindfulness is to allow people to sit still with their symptoms. As they practice this, they can accept their symptoms and be okay with their pain. They have less suffering as they are not fighting their pain. The ability to sit with your experience can allow you to feel at peace and relax in a way that can be very pleasant. If you are doing things that are important to you, you will find that your pain bothers you less. It is for this reason in pain management that we encourage you to share your goals and values. When you are trying something that is important to you, you will have the strength and motivation to move forward. The mindfulness exercises such as the mindfulness of breathing, the body scan, and the values-based goal setting are based on mindfulness approaches. Cognitive behavioural therapy, CBT approaches to pain management. A long time ago, we used to think that pain was something that only happened in people's bodies. We now know that pain also has a strong emotional part. Being in pain not only affects the way we feel, but the way we feel can also affect the amount of pain we are in. To test this out, ask yourself the following questions. Do you usually feel emotionally worse on the days when you are in pain? Does your pain tend to get worse when you are stressed, tired, or upset? If you answered yes to either of these questions, you are a normal human being. Congratulations. When people are feeling stressed or low in mood, their brains and bodies have higher levels of stress hormones. We've learned that having a higher level of stress hormone can make someone more sensitive to pain, so it's very easy to become trapped in a cycle of stress and pain. And below this there is a diagram demonstrating that hormones increased pain sensitivity leads to increased pain, which then leads to stress and low mood, which then can circle back to lead to hormones increased pain sensitivity. Thinking about pain. Our minds are always working away in the background. They try to make sense of what's going on around us and how we feel about things. We use what we know from the past to work out how we feel about things now. We also use what we know to make predictions about what will happen in the future. Most of the time, our mind is very helpful. For example, your mind helped you to take all the necessary steps to get out of bed this morning. It can also help you to think about all of the things you need to do tomorrow. But sometimes our mind can be less helpful and can even become a negative influence on how we feel and what we do. Enjoyable movement and exercise. The idea of enjoying movement and exercise may seem odd for people with chronic pain, especially if people have found that previous exercise or physical activity made their symptoms worse. The following approaches to movement and exercise will help increase your ability to do things that may have become difficult. The principles of exercise are not aiming to relieve pain. While exercise can help pain on occasion, we teach exercise to increase well-being and to allow us to do what we enjoy or need to do. Benefits of exercise. Sometimes certain exercises can relieve pain. For instance, if that pain is due to joint stiffness, lack of activity or muscle tightness. Exercise can also make us feel better from a mood point of view. Our bodies release chemicals, enkephalins and endorphins, etc. when we exercise. These feel-good chemicals improve our mood. However, even if this were not the case, we would still teach exercise aimed at increasing physical activity in the program. Why would we do this? The answer is that the basic fact is that our bodies need to move. Most of the chronic problems with health in our society can be linked to some degree with the wrong types or quantities of food and a lack of physical activity. If you don't move, you'll get unwell, as lose the ability to walk well, balance, or do activities that we used to take for granted. The problem for people with ongoing pain is that this unwellness comes on slowly, whereas the pain hurts now. This makes it unlikely that we will want to move. We will usually avoid the immediate pain rather than remember the long-term benefit. Let's consider the benefits of exercise. So the benefits of exercise gets us fit. Fitness is the balance between the physical and emotional elements of our life. Being fit improves cardiovascular, muscular and motor fitness as well as flexibility. Cardiovascular fitness, improved ability to take in and use oxygen. It improves how well we use our heart, lungs, and how well our circulation works. Strength, we can use more force. Endurance, the more we exercise, the longer we can do an activity. Progressively working against resistance will improve both of these components. Flexibility, we can become more flexible. This is more comfortable and means we are less likely to hurt ourselves. Motor fitness, our coordination and reaction time improve. Mental health, regular exercise is helpful for mental well-being and can help with depression and anxiety. People with chronic pain often avoid activity because of the fear of damaging themselves. Because of this avoidance, they can end up becoming unable to do things that are important. This catch-22 of definitely becoming unable due to a fear of possibly being unable needs to be overcome. So to get back to activity, we will learn to firstly separate our experience of movement or exercise from pain. We need to reduce our fear of movement. We need to find a level of exercise that we can easily manage. And we need to start enjoying the process of movement and being present in our own body. For this to happen, the exercise needs to be pleasant, relatively pain-free, and increased very gradually to help us build up our confidence. Our aim should be to make the movement or exercise enjoyable. For this to occur, the exercise will need to be done in a relaxed and self-aware way. It'll also need to be done as a general exercise, not using the exercise to fix something specifically, and emphasizing quality, not quantity. It also needs to be consistent. So, relaxed and self-aware. We would suggest starting every exercise session with a mindfulness-based activity, such as the body scan outlined later. This will help you to tune into your body and work at a level that is appropriate and enjoyable. These mindfulness activities can allow us to make choices about our response to movement. We can become aware of our responses and learn to do easily manageable movement that will not increase our pain sensitivity, but will move us on towards a better level of fitness. General exercise. If you focus on a sensation, it usually gets stronger. So if you try to repeatedly fix a pain problem, it too can get stronger. Try using exercises to move towards general goals of fitness and well-being rather than trying to fix a problem. This will keep your focus on the positives rather than keeping your focus on trying to get rid of the negative. quality, not quantity. Good movement quality will ensure that the body is moving in a normal way. Doing this will gradually improve strength and ability as the body moves in the way it is supposed to move, rather than limping, which makes changes to our muscles and joints. Normal movement allows us to move in an efficient and usually less painful way. Moving, exercising consistently. In next week's section on pacing, you will see how our activities have become inconsistent when we live with a chronic condition. With gentle, consistent movement and exercise, we can learn to overcome this boom, bust, or over/underactive cycle. Over time, you will find that using gentle, consistent effort is more effective than trying to push on through and can give better longer-term results. Rather than trying to get fit all at once, which often leads us to fail, we try to go for a gentle, steady, and graded approach to exercise. Remember, we are in this for the long haul. There is no rush. Terminology. You'll notice that when we introduce exercise, we talk in terms of what is easily manageable and not in terms of comfort. We do this as we are trying not to put comfort and therefore pain in charge of your exercise level. If we put pain in charge, then we undo what we are trying to do. So, let's start by pulling up a chair, sitting down, and taking 3 deep breaths. Great. Now lift one hand over your head and hold for around 10 seconds. Repeat with the opposite hand. Place both hands above your head, lean to the right, hold for 10 seconds. And then lean to the left and hold for 10 seconds. You can do these reps more than once, gradually increase them up to 10 as your body feels more comfortable. Making sure your shoulders are still relaxed, place your hands on your shoulders and then roll them forward 10 times. And then backwards 10 times. Please bear in mind you can pause this recording at any point if you need to take a break. Now relax your shoulders, moving your arms in circles. 10 times forward. And then 10 times back. Keeping your shoulders relaxed, with your hands together, move your elbows together 10 times, opening and closing. Go on. Place your hands on your thighs, keep your back straight and lean forward and backwards 10 times. Now touch your hand to opposite knee, hold for 10 seconds. Repeat with the opposite hand. Now let's exercise those feet and leg muscles. Place your feet flat on the floor, then point your toes up towards the ceiling and repeat 10 times. So lifting feet up and down whilst heels remain on the ground. Now lift your knees up one at a time, repeating 10 times. You can do on one side and then repeat on the other, or alternate between the two. Wiggle those toes, don't forget both feet. Cool down by taking 3 deep breaths. You did a great job. Go ahead, give yourself a hug. Don't forget to stand tall and stretch upwards several times a day. So next we move on to an introduction to relaxation and mindfulness. Why is relaxation important? Relaxation technique. If you know a way of relaxing that you like, it's fine to continue to use it to relax. However, the following relaxation technique, which you may also find helpful, can be used at any time or in any place. To begin with, practice this technique in a sitting or lying position. As you get better at it, practice while standing, walking, and even while talking or during normal activities. Learning to do this will make this relaxation technique more useful for you. Diaphragmatic breathing. The way that you breathe is important. Shallow breathing or holding your breath because of pain can increase tension. This tension can then increase pain. The diaphragm is made from muscle and tendon and is parachute-shaped and attached around the bottom of your ribs. As it changes shape, it makes more or less space for your lungs, which expand and contract, pulling in and expelling air out. When you breathe correctly by using your diaphragm, your belly will rise as you breathe in. Check that you're breathing well by placing one hand on your belly just below your ribs and the other hand on your chest. When you breathe in, the hand on your belly should move more than the hand on your chest. As you breathe out, your belly will fall as the air is pushed out of your lungs. Below that, there is a diagram showing that as you breathe in, the diaphragm flattens down, pulling air in, and relaxes up as you breathe out, letting the air out. So, for this relaxation technique, get yourself into a comfortable position, focus your mind on breathing, take a deep breath and let it out slowly. Repeat. breathing calmly and gently, trying to breathe deep down into your belly. As you breathe in, say to yourself the word in. As you breathe out, say to yourself the word relax. In and relax. In and relax. And keep repeating. As you breathe out, let your muscles relax and go floppy. And imagine that the tension is draining away as you breathe out, even if it doesn't feel like it is. Go through the parts of the body, one after the other. Look for tightness or tension and gently try to let go of it. Keep repeating those two words, in as you breathe in, and relax as you breathe out, relaxing your muscles when you breathe out. Remember, practice makes perfect. It will take time to become good at this. Try to do this technique before too much tension has built up. Try relaxing when you're doing different things. You can try scoring out of 10 how relaxed you feel. If you score yourself before and after the relaxation, you can see any changes that you've made. This may encourage you to do the relaxation more. How can mindfulness help with chronic pain? Mindfulness-based approaches. Imagine a situation where you are living with a relative you really don't get on with, someone who you constantly bicker and argue with. Imagine the stress of this. Every day you argue with them in the same old way. You see them in the same old way, and you expect them to behave in the same old way. And you get angry with them in the same old way, especially when you behave in the way, or they behave in the way that you expected. This causes constant stress and frustration, and it's difficult to live with. Basically, your relationship with your relative is poor, assuming nobody is going to leave, because maybe they can't. The only way to improve things is to improve the relationship. You would need to learn how to get on. It's very similar with the process of living with chronic pain. We are under constant stress because of the poor relationship that we have with our sensations. We have habitual and tiring emotions that arise when we experience these painful sensations. Mindfulness-based approaches to chronic pain can help us change our relationship with our pain, even if the pain stays the same. Evidence shows that mindfulness-based approaches allow us to change or reappraise our experience of our sensations. This means that mindfulness-based approaches allow us to change our relationship with our pain sensations. This changes the amount of suffering and frustration that we feel towards our painful physical and emotional sensations. Below this is a diagram with the words mindfulness practice linked to integrates emotions, reduces anxiety, relieves chronic pain, calms body, and decreases stress. Mindfulness consists of techniques that, number one, get us to experience our sensations in a non-judgmental way. Number two, it changes how we view and label our difficult experiences so that our relationship with it changes and it's no longer experienced as a problem. Allow us to be in the here and now, and not worry about the future or regret the past. Being constantly worried about the future and regretting the past causes us to suffer. The techniques we will look at in the next few weeks will be the body scan, the mindfulness of breathing, 3, the development of kindness, 4, the pain desensitization practice, and 5, a moving meditation. The 3-minute breathing space. The 3-minute breathing space is a brief practice and can be used when we find our thoughts or mood are spiraling in a negative direction. The first thing we do with this practice, because we want to come into the present moment quickly, is to take a very definite posture. The back is erect but not stiff, letting the body express a sense of being present and awake. Now, close your eyes. If this feels comfortable, take the first step of becoming aware of what is going on with you right now, becoming conscious of what is going through your mind, what thoughts are around. Here again, as best as you can, just noting thoughts as mental events. So we note them, and then we note the feelings that are around at the moment, in particular, turning towards any sense of discomfort or unpleasant feelings. So rather than trying to push them away or shut them out, just notice them. Perhaps saying, there you are. That's how it is right now. Similarly, with sensations in the body, are you holding on to sensations associated with tension, or are you letting go of them? And again, becoming aware of them, simply noting whatever is arising in this moment. So you have a sense of what is going on right now, having stepped out of automatic pilot. The second step is to collect your awareness by focusing on a single breath. This is an example of a single moment or action. The breath is easy to use as a point. So now really gather yourself, focusing your attention down in the movements of the abdomen, the rise and fall of your belly as the breath moves in and out. Spending a minute or so to focus on the motion of the abdominal wall, moment by moment, breath by breath, as best as you can, right here, right now. Noticing when the breath is moving in, when the breath is moving out, being with the breath as it moves into your body and out, finding your awareness to this process. Be present right now. The third step is allowing your awareness to expand to the entire body, bringing a more spacious awareness of your experience, letting the breath be present but in the background, bringing attention to the entire length of the body, from head to toe, including any tightness or sensations related to holding or bracing. In this moment, holding your awareness in this spacious place, breathing in and breathing out, and when you are ready, opening your eyes, letting go of this breathing practice. That's the end of week 1, first workbook in the Pain Management Program Handbook series. When you're ready, move on to week 2. We'll see you there. Goodbye.